Lubino with Senior Advisors. It's September of 2020. This year has been different for a lot of reasons, but we wanted to stay consistent with our review, the video that we share each year as it relates to Part D of Medicare and the changes that are upcoming for 2021. So this video will explain how the different phases within Part D of Medicare work and also highlight some of the changes within 2021. And we'll also walk through an example for folks that have very expensive medications that are curious how Part D of Medicare works with the donut hole and the catastrophic levels. I'll walk through an example there as well. So this slide that you're going to see here is similar to the one we've shared in prior years. We just updated the values based upon the upcoming changes for 2021. But basically, there's 4 different steps within Part D of Medicare. The first one being the deductible. The second one, the initial coverage level, followed by the coverage gap, which is also known as the donut hole. And then the last step is the catastrophic coverage level. And the way this works, all Part D plans have to follow these rules. So these are rules that are defined by the federal government. There's about 30 different Part D plans in each state, and each of them have to follow these rules. So what that means is they can have a deductible on these Part D plans, but they can't be any higher than next year it's $445. So this went up $10 from 2020 to 2021. If the plan has a deductible, it says member pays all, the plan pays nothing. Well, there's a star next to that because that's really only for the higher tier drugs. So generally, these plans have 5 tiers of drugs in their formulary, and the lower tier, lower cost drugs, generally the deductible does not apply. So it normally only applies to the tiers 3, 4, and 5 medications. All right, and the plan also could have a $0 deductible or a $200 deductible, but it can't be any higher than $445 next year. All right, after the deductible comes the initial coverage level. 85% of people are not going to get past this point. So if you don't have expensive medications, or you just have basic low-cost generics, blood pressure, cholesterol, whatever, as long as the total cost for the year of your drugs based on the retail cost does not exceed $4,130 next year. This went up about $110. As long as it does not exceed $4,130, you're just going to pay a copay or coinsurance for your medication. Could be $5, $10, $40. Whatever that copay or coinsurance is based upon that drug and that plan, that's what you're going to pay the entire, initial coverage while you're in that throughout the year. However, if you have very expensive drugs, and it's going to get very confusing right about now. So if you don't have expensive drugs and you're not interested in the detail about the donut hole and how that all works, you probably don't need to watch the rest of the sections, or you can skip to the end. But we're going to get into now the specifics of how the donut hole works. So if your drugs exceed $4,130 retail, you fall into this coverage gap where you have to pay 25% the cost of the drug. So there used to be no protection years ago in the coverage gap where you would have to pay 100% of the cost. And then it dropped down to 50%, and then it gradually went down from there, and it's plateaued at 25%. So while you're in the coverage gap, you pay 25%, the plan pays 5%, and the pharmaceutical company is discounting that drug 70% while you're in that coverage gap or donut hole. All right. Again, only about 12% of people are going to reach this coverage gap, and about 4% are going to reach catastrophic, which I'll show you in a minute. So how do you get to catastrophic? Well, it's another variable. Now it's based on true out-of-pocket costs. So remember, it was retail cost to get into the donut hole, and then it's true out-of-pocket cost to get out of the donut hole into the catastrophic level. And the catastrophic level is there to protect you so you're not stuck at 25% for the entire back half of the year. If you hit the catastrophic level, you just pay 5%, or $9.20 for brand name drug, or $3.70 for generics. All right. Now, what is true out-of-pocket, or TROOP? All right, and these are not my definitions or acronyms. This is the government. But essentially, the $65.50 true out-of-pocket includes everything that you've paid for your medications up to that point in the year, plus it includes the amount the pharmaceutical company is discounting while you're in the coverage gap. So that 70% they're discounting while you're in that coverage gap applies to your true out-of-pocket. That's a very good thing because that means you don't really have to spend $65.50 out of your dollars to get to that catastrophic level where you're paying 5%. Okay, it's going to vary based upon your medications and the plan that you're on, but if you have expensive medications, you're probably going to spend between $1,000 and $2,000 to get into the coverage gap, and then you're probably going to spend another $1,000, $2,000 to get out of the coverage gap and into catastrophic coverage. All right. So again, it's retail costs to get into the coverage gap, and it's true out-of-pocket costs to get out into catastrophic. I know it's very confusing, which is why I want to provide this example, which we provide each year. And all I've done here is I've updated the figures based upon the 2021 numbers. So this is for someone, again, that has expensive drugs. This is a simplified example with one medication, but the rules apply the same if it's a total of 4 or 5 or however many meds that total up to this number. This example has one drug. It's a brand name drug. It's $955 a month retail. All right, that's the retail cost. The copay in this example is $40. And this Part D plan has a 0 deductible. Again, just for simplicity's sake. The initial coverage level we just explained went up to $41.30 for next year. So that's going to delay a little bit for when you're going to hit the donut hole, very minor impact. And the catastrophic true out-of-pocket went up also a little bit there to $65.50. So what that's going to do is delay a little bit when you're going to hit the catastrophic level. All right. This table below shows you month by month how your drug costs would work in this example. So the first 4 months, you're just paying that $40 copay, January, February, March, April. Then in May is when you would reach that coverage gap or the donut hole. And the reason is, remember the retail cost, that $955 a month, if you add that up and you keep adding it up, you're going to exceed that $41.30 retail by the month of May. Now you're not fully in the coverage gap in May because you're between April and May, you're just hitting that $41.30. And then by June, you're fully into that coverage gap. So that's where you're paying the 25%, the $238 a month, which is 25% of the $955. May, again, is a partial month, but then you're paying that $238, for most of the rest of the year in that coverage gap that you're in. All right. Now, you're also going to reach the catastrophic level in this example, and it's not going to be until December in this example that you'd hit the catastrophic level. Now, why is that? So if you look down here at the bottom of this table, we have the true out-of-pocket cost that's totaling here. For the first few months, it's just what you've paid for the medication, the $40 a month. When you hit the coverage gap, it's going to include what you've paid, the $174, plus the pharmaceutical discount, that 70% that's being discounted while you're in the donut hole. That's $600 a month. That total is $778, which will apply plus the $160, and it's just a running total. The next month it's a full month in the coverage gap, so it's $907 that's going towards that true out of pocket. And you just, take that running total, and by the month of December, now you're going to exceed that $65.50 because you had $63.82 at the end of November, and December is almost a full month in the catastrophic level, not quite. So it's a little bit more than that 5% that you would pay. 5% will be closer to $40 or $45 or $47 a month. This person's paying $83 in December because it's a partial month. If there was another month in this model for the same year, you would go down to the $47 for that drug, okay, because that's a partial month in December. When we looked at this last year, because the catastrophic true out-of-pocket limit was lower, you actually reached catastrophic in November, and then December was a full month of the catastrophic coverage. All right, so the total for the year, if you just add up each of those months, it comes out to $1,850. That's the out-of-pocket cost for that member. All right, it's not a flat 8. You can't divide that by 12 and budget out that amount each month, because it's not going to be like that. It's going to be a lower start to the year. It's going to increase when you get to that coverage gap, and then it's going to drop back down when you get to that catastrophic level. So. But again, for budgeting, it would be roughly $1,850. When we compare this to last year's numbers, because of the increase to the true out-of-pocket initial coverage level, it's a minor net impact, about $25 increase from 2021 versus 2020. Again, this doesn't factor in any change to the cost of the drug or how the plan is changing their copays and things. This is just how the different steps of Medicare change based upon the initial coverage and the catastrophic level. So I hope that example helps illustrate how this works if you have those expensive medications. Again, only about 15% of people hit this coverage gap or the catastrophic level. So Now, there's another change coming for next year, which is pretty exciting for folks that have chronic conditions like diabetes, where you have a medication like an insulin. Insulins are very expensive. The retail cost, depending on the manufacturer and the way you're taking it, could be $400 to $500 or more per month for those insulin medications. So what that means in the current state, people are reaching the coverage gap and having to pay a lot for those medications throughout the year. So earlier this year, CMS issued this order to create what's called the Part D Senior Savings Model. And this is going to start in this coming year, 2021. So the plans will be available in October for us to look at. And specifically what this does is for those folks that have chronic conditions, they're going to build a flat copay, which gets rid of the deductible, the initial coverage, the coverage gap, and the catastrophic level. And it's going to be like $35 a month for insulin, period. So there's no fluctuation in pricing. There's no 25% the cost that you're going to have to pay if you hit the coverage gap for the insulin. And if you have a plan that has these Part D savings model, you'll have that flat copay, which is going to save a lot of money in out-of-pocket cost. We project about $500 for the year in savings in out-of-pocket cost. Now, we don't know what these plans are going to cost yet, so the premium may offset some of that savings, but we'll have visibility to this in October when those plans come out. But that should help definitely net save, provide some net savings for folks that have those expensive chronic conditions. So advisors.com/free-rx-analysis. And there's a form there you can fill out with your medications, your dosage, your frequencies, and some other information, and we will complete a Part D analysis for you. The tool we're using is going to look at every Part D plan that's available in your area. There's, again, about 30 different drug plans to choose from, and the tool we use is available on Medicare.gov. It's called the Medicare Plan Finder, so you can do the analysis on your own if you prefer, but if you'd like us to do it, we'll be happy to do it if you fill out the form with your information with the drugs and the dosage. And we will send you a report with a recommendation and your projected costs. And if you don't work with us for your Medicare planning, you might not be too happy. You may make a mistake or not choose the right plan or coverage, and you might not be too thrilled with that. So we have a lot of resources out there. You can follow us on Facebook. We provide updates there. We have a lot of YouTube videos. This video will be on YouTube. You can subscribe to us on YouTube, and you'll get updates when we post new videos. We have a lot of content on our website. We have a full 90-minute Medicare workshop video if you want to watch. Free Part D analysis form we just mentioned. We do blog articles. We have quote forms if you want to get quotes for Medicare supplements or Medicare Advantage plans. You could do that. And you can also call us if you want to reach us directly at the number you see here. And that's essentially what we wanted to cover in this video. We hope you found it helpful, and we look forward to a better 2021. Thank you, and have a great day.